Which of the following terms best describes the underlying cause of the clubfoot? A pregnant woman undergoes a routine ultrasound at 20 weeks gestation. The ultrasound reveals clubfoot in the fetus. The obstetrician explains that this abnormality is likely due to mechanical force acting on the developing limb. Which of the following terms best describes the underlying cause of this clubfoot? Man, I get these confused all the time. I think it's not dysplasia, it's not teratogenesis. Um, One of them literally means like an outside force acting on developing limb. And
Hmm.
so is it disruption or deformation is my opinion. Um, I think it's gonna be disruption. That's my gut guess, and I honestly just forget.
All right. So
Yeah.
deformation. Okay. Twisted out of shape. In this case, clubfoot is likely due to a mechanical force acting on the limb, which is deformation occurs when abnormal mechanical force act on normally developing structure, leading to a normal shape or position. Malformation, as you know, right, development and structure leading to right intrinsic, right. So it's malformed, meaning that it developed wrong, right. Disruption,
Mhm.
damaged or destroyed by an external force or event leading to abnormal appearance or function. This is not the case in scenario. Clubfoot is a mechanical force. So some kind of like maybe like a infarct or something like that that destroys it.
Do they not say like the like placental like when it ties around their arm or something like that? That's disruption or this is deformation?
Let me see. You're talking about amniotic bands.
Yeah, amniotic bands.
Yeah, let's see. Amniotic bands, disruption or deformation. Let's see. Okay, then return 5%. I guess. Then, let's see. What is fetal deformation versus disruption? Let's see. Let's see.
That's why I get these confused. I think they're just like really close, but
They're
slightly
very
different.
close. So disruption. Let me look up deformation again. I think malformation and deformation might be very similar. See, malformation versus deformation cannot be correctly fetus
They say that amniotic band sequence is disruptions.
is disruption. Okay, my
It
understanding.
says
So
when normal tissue is damaged or interrupted, as in band
maybe
sequence.
it's more acute, and then deformation, um, fetus. Yeah, so okay, so I understand it. Okay, so here's the main difference here. Okay, so these malformation makes sense. It's intrinsic, right? These two are external. Okay, I think disruption is more severe. It's like a how do I say this? Like you're cutting something off, like an infarct or amniotic bands that's like loosening, like it's completely cutting it off, right? That's a disruption.
Mhm.
Deformation is more like a slight push, right? That you're positioned wrong, and so your leg forms like that. You get what I'm trying to say?
Yeah, so almost like I remember I just saw this too just when I was looking it up. Potter sequence is a deformation, like
Yeah,
the compression of like the face.
yeah,
Um,
exactly. So that makes sense, right? Because you have oligoamnios, right? So low amniotic fluid, so you're stuck in a very tight corner, and so in a tight space with your womb, right? And so the fetus is kind of being squished, and so as you're trying to grow out, you're being pushed in, and so
mhm.
you get Potter sequence. So that's deformation. So amniotic bands is pretty much like a constriction around a limb or a finger, and so it cuts it off completely.
Okay.